cardiofocus catheter ablation system, or the laser balloon, offers the unique opportunity to have a true insight into the beating heart. And this, I think, from my perspective, allows a physician to, number one, control and precisely tailor the point of delivery of energy using basically a visual guidance. This is, I think, very important, number one. And number two, the cardiofocus system also allows us to titrate energy. So we know certain regions in the heart may be a little more difficult and maybe more challenging to obtain a transmural lesion. And in these regions, for instance, we can increase energy application, whereas in other regions of the heart, we know we rather want to go down with energy, and so we can tailor basically and individualize the energy application to our patients.
My name is Boris Schmidt. I'm a cardiologist and electrophysiologist, and we are, or as a part of a group of cardiologists, we are running a private office in Frankfurt at 2 hospitals. And this hospital here is the Marcus Hospital, which is part of the Ablate hospital chain, running a large number of hospitals across Germany, and are running 2 cath labs primarily focused on interventions in the field of cardiac arrhythmias, doing catheter ablations, but also doing interventions for structural heart disease.
My name is Julian Chun. I am working as a co-chair chief electrophysiologist in Frankfurt at the CCB Center, and together with my colleague Boris Schmidt and I, we started doing high volume catheter ablation procedures. I am specialist in all types of catheter ablation, and I have worked scientifically in the field of electrophysiology and atrial fibrillation.
Catheter ablation for atrial fibrillation has become a class 1 indication, which is very important, and we've been struggling for this for a long time. But I think unequivocally all studies show that catheter ablation is better than drug treatment, even as a first-line therapy, meaning that you would not treat a young patient with a potentially harmful drug if he has paroxysmal atrial fibrillation, but you would recommend him to undergo an ablation procedure. It all started off with radiofrequency current ablation, which is delivered via a tip catheter. That means that you're basically manipulating a thin wire from the groin of the patient in the left atrium, and you are ablating in a point-by-point fashion around the pulmonary veins, or it all started off in the pulmonary veins, which was terribly associated with complications, and then we went out through the left atrium and did a circular or circumferential ablation around the pulmonary veins. And as you could imagine, this is very difficult because you need to manipulate this thin wire in a contiguous fashion around the pulmonary veins.
What happens in general with a 3D mapping system and a manual point-by-point or radiofrequency current ablation approach, it requires different little tiny steps to first, number one, to build geometry of the left atrium, and number two, to create a point-by-point contiguous linear lesion. After inflation of the balloon and obtaining good contact of the balloon with the tissue, we can use the installed camera to see and to virtually really see where we're gonna be deploy the energy and where we're gonna ablate. And of course, instead of doing multiple tiny movements, it's basically the one movement into the vein, inflating of the compliant balloon, which is very safe, and then just using the point-by-point laser energy to create a circumferential lesion.
You are navigating the balloon catheter to the individual veins, which means that you're basically doing only 4 movements throughout the whole procedure. And as soon as the balloon is inflated at the pulmonary vein, it sits there in perfect contact and stability. We learned that even with a low level of experience, you can get easily very good clinical results in terms of patients being free of atrial fibrillation after treatment. So the learning curve for new users is very short and steep. It can be carried out by a single physician. You don't need any medical assistance in terms of another physician doing or sitting at the mapping system, for example, or helping you at the table with catheter manipulation. You can really do it as a one-man or one-woman show, which is certainly of interest from an economical perspective. When we perform 4 or 5 ablation or atrial fibrillation ablation procedures per day, you do not only have to have an efficient tool, but also a quicker tool for atrial fibrillation ablation. And as I mentioned earlier, a tool that you don't need too many people to be involved with. So it makes my life easier because it's a very quick procedure. Usually the procedures last 90 to 110 minutes, which is very acceptable these days. And second, the procedure can be simplified by reducing the need for additional material and manpower. So I think not only for the ease of the procedure, but also for economical considerations, it's an innovation.